I think what's really cool about the Provide model is it doesn't try to change the perception per se, but it definitely offers another point of view for folks to even be thinking about when trying to offer this type of compassionate referral care. To me, that also is healthcare. That also is service. You know, the referral process, that intake time with a patient is very important, and that's where you could lose a patient and never be able to get their trust back again. And so, you know, for us, it's very important that while we are advocating for our medical community to actually be more intentional about being careful and humanizing their patients and not making it kind of like this assembly line of people that they're serving, but to pause and recognize that you're dealing with someone who has real emotions. A lot of times that could be an emotion that came from incest or rape. Some of that could be, you know, that they are 15 years old and they've been hiding a pregnancy, you know, for the last, 15 weeks. And so now we're down. It's very crucial then, if they're going to have an abortion, that they're able to do that in a way that doesn't, hinder them because of another layer of emotional garbage that they've been thrown, but that young woman may have an opportunity to know that at the very least my doctor has my back, or at the very least my pastor has my back, because at least they gave me the information that was real information. They weren't getting sent to a crisis pregnancy center, or they didn't stumble upon it by mistake, but they actually went to a safe place for an abortion. I mean, that's paramount, and I think that's a niche that Provide has, and obviously one that maybe we had just kind of been glazing over in the movement, as something as far as the provider level, that service model, that I think a lot of us might have been missing, that was really important to be an additional voice, an additional strategy, and for advocacy for women that we needed. So I'm glad that Provide exists.